Welcome everyone to today's webinar, how Ochsner Health fuels high-quality patient care with physician well-being. I am Molly Gamble with Becker's Hospital Review. We'll begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. Today's session is being recorded and will be made available after the event. You can use the same link used to log into today's webinar to access that recording. At this time, I am pleased to introduce our presenters for today's webinar. Dr. Nigel Girgra is the Chief Wellness Officer at Ochsner Health System. Dr. Christine Sinski is the Vice President of Professional Satisfaction at the American Medical Association. And Jim Gilligan is the Vice President of Health System and Group Partnerships at the American Medical Association. At this time, I'm pleased to turn the floor over to Jim to begin today's presentation.
Thanks, Molly. Good afternoon, and really glad everyone logged in is able to join us this afternoon. Even before the pandemic, but certainly during, there's been a major need for healthcare organizations to address burnout and look for ways to improve provider satisfaction. Our AMA Professional Satisfaction team, led by Dr. Christine Sinski, has collaborated with hundreds of organizations to develop solutions to do just that. In a minute, we want to take a moment to put a spotlight on one of those partners, Ochsner Health, and Dr. Girgra. Ochsner Health has been an amazing partner to work with, not just because of the great results they've driven. Their commitment from the CEO all the way through the health system to improving the lives of their physicians and providers has been truly inspiring. Some of you joining us today may be surprised to hear the AMA offers these type of resources and support. I know many healthcare providers see us as an organization that offers benefits to individual physicians. Our goal is absolutely to be a powerful ally for all physicians, but we realize an important strategy for accomplishing that is making sure that their health system or their medical group has everything they need to drive support to their providers. My role at the AMA is to work with the teams across our organization to bring our health system partner program to life. This program offers group solutions to enhance their ability to support their physicians by giving them opportunities to enhance their patient care, get credit for the work that they're driving, and a chance to work in a culture that drives more joy in practicing medicine. Ochsner Health is one of these partners, and since I know everyone is here to learn from them and their story, I will turn it over to Dr. Nigel Girgra, the Chief Wellness Officer, to talk about the journey Ochsner has taken to improve satisfaction. Dr. Girgra?
Hey, thanks, Jim, and thanks for the opportunity to be with you all. So I wanted to tell you when burnout became personal for me, and that was in September of 2013 when I returned to Toronto for my med school reunion, and I don't think I'd even heard of the term burnout before then, and I saw that my friend Craig was missing. Now, Craig was a highly accomplished surgeon in Ontario. He had performed the world's first laparoscopic telerobotic surgery. Craig even had his own wiki page. And I learned at the reunion that Craig had committed suicide a few months earlier. And it was when I went into Google and find out more. I saw the story, alcoholism in 2009, licensure revoked the following year. Hospital privileges suspended, a criminal case, witness tampering, and even this well-documented high-speed police chase across rural Ontario. And I was devastated. This was a friend who used to visit my parents' home on long weekends during med school, and I just couldn't figure out how this had happened to him. Now, over the subsequent few years, I'd had several conversations with my chief medical officer, Dr. Robert Hart, who I knew shared an interest in physician well-being. And in May of 2017, he sent an open letter out to the physicians and APPs, really declaring an organizational commitment to provider well-being. In his letter, he described the duality of our roles as clinicians. The profession that we enlisted for, to be a clinician, a healer, and then secondly, the profession perhaps we didn't really enlist for, so some of the regulatory and economic considerations. And I think he and I recognized that with all the organizational and professional challenges associated with healthcare reform, improving quality and safety, engineering cost out, improving patient experience, we needed the collective A game of all our physicians and clinicians. And Wellbeing appeared to be a vehicle to get us there, and Burnout was certainly a threat to achieve those goals. A few months later, he asked me to chair what we called the Wellbeing Task Force. This was in the summer of 2017. And over the course of the next 12 months, we took a very deliberate look at drivers of burnout and potential solutions. We sort of looked at quantitative data, so we looked at the NASDAQ burnout inventory, our engagement surveys, our culture safety surveys. We kind of married that with qualitative data. Over the spring of 2018, I conducted a number of focus groups across the organization at different facilities. We tried to distill that down to a voice of the customer, and this provided a framework for my recommendations to the executive team when I presented out to them in the summer of 2018. And two of those recommendations were, one, to appoint a chief wellness officer, and then secondly, to resource an office of professional well-being. Now, a couple of months later, I sort of saw where this was going, and he asked me to be chief wellness officer. And quite frankly, at first, I had reservations. Most of my professional identity was in traditional physician operational leadership roles. I didn't know whether we'd have a playbook for success. And honestly, I wasn't clear at that time whether there would be true organizational commitment. But it was clear that it was my passion, and eventually I accepted the role. And this sort of coincided with Ochsner reshaping our 10-year strategic plan. And I think it's a really aspirational strategic plan. And that is shown here. And it's to, by 2020, make Louisiana, our patients, our employees, healthier. And to do that, we're not going to do this by ourselves. We need to be a catalyst, an influencer within the state. We even rebranded ourselves from Ochsner Health System to Ochsner Health, and called ourselves a system that delivers health rather than a healthcare system. And to do this, it starts with a few things. It starts with really our own people, elevating the mental, physical, and economic health of our employees and our physicians, elevating the health of our patients we serve, the broader communities that we serve, and finally, this at the right, this sort of bold 10-year goal. Louisiana always competes for 49th or 50th in terms of healthcare rankings by state, and we wanted to, in 10 years, get to 40. We call this the 40 by 30. So, it really is essentially the organization's recognition that well-being is a leading quality indicator that drives our strategy, that fuels our strategy. It drives better quality and safety. It drives better population health outcomes. Certainly leads to better patient experience and overall consumerism. And I think it's closely aligned with our organizational diversity and inclusion imperative. So in November of 2018, all of a sudden I'm this chief wellness officer leading a brand new department. At the time, I kind of had a high-level understanding of what needed to be done, but I had no playbook, and I needed help with people who had strengths that I didn't have, and help to really, tackle such a widespread systems issue at an organizational level. And so up here is my small but mighty and amazing team. So my admin dyad is Melissa Love. You can see her there. And we hired Ashton Sloan to be our real operations lead. He's our AVP. Ashton is a practicing PA in critical care, but he has a wealth of experience and talent in project management. And then finally, the amazing John Sawyer, who's a neuropsychologist who leads our professional experience program. And he's been like a true superhero in our post-COVID response, for sure. So this kind of closes out the first part of this talk. So this really was our 2017 to 2019 roadmap, and I mentioned some of this before. It started off with the Wellbeing Task Force being assembled, being very deliberate, not quick, but deliberate to look at quantitative data. I mentioned the Maslach Burnout Inventory, which proved to be actually a little cumbersome and not too nimble. I talked about the Gallup Engagement Survey, our focus groups, but I think a real critical step was our partnership with the American Medical Association and being able to use their resources and really specifically their Mini-Z Wellbeing Survey Index. And then finally, last year, I had a chance to spend a week with Dr. Sinsky and a number of other thought leaders in this area at the Stanford Chief Wellness Officer course, and I think this sort of helped inform where we were going as an office. So the American Medical Association provides really boots on the ground support. This is a picture of Dr. Sinsky. She's in the middle, flanked by Dr. Robert Hart, our Chief Medical Officer, and by myself. And this is at a Q&A in front of our physicians and APPs. She'd just given a fantastic presentation on the subject, and I had presented for the first time to the group practice our first stab at a strategic plan. But earlier that day, she had also met with some of our key executive stakeholders that weren't physicians, but who we needed buy-in to discuss the importance of this subject. And while this is great, I really want to tell a story about 2.5 years ago, so 15 months before this picture, when I was not the Chief Wellness Officer. I was just the chair of the Wellbeing Task Force, and I was really, quite frankly, a bit lost. And so I remember emailing Chris Sinsky, thinking, yeah, right, I'll be lucky if I get a reply from this national thought leader. And within 30 minutes, there was an email reply. And then a few days later, I was on the phone with Nancy Nankiville, who she works with, and Dr. Sinsky. And I think this really reflects the commitment that the American Medical Association has to this subject. The AMA also has this great website. It's called the AMA Steps Forward website that anyone can access. And on this website, there's all sorts of great modules that help guide an organization tackle these issues and think about strategy. And what I really like about it is it's very solutions oriented. And it certainly was very helpful for me in our organization. I will say that one of the learnings from the Stanford Chief Wellness Officer course was the importance of putting strategy before tactics. I think you can run the risk of having about 149 great ideas, but if it's not part of a broader strategic plan, it's less likely to have success. And as I mentioned earlier, I think you have to surround yourself with people with different skill sets. And I think one unique differentiator of the Office of Professional Wellbeing has been our disciplined, rigorous approach to the subject and really using project management philosophy. And I credit Ashton Sloan, who's been a real key ingredient of this. And it is an upfront investment in time, but you need to develop a broad coalition of key stakeholders and getting everybody on the same page. A lot of this work has been informed by the AMA Mini-Z survey and other resources, and I think the strategic approach has saved us months in wasted time. So this was our first stab at a strategic plan that was presented to our executive team in the summer of last year. And our initiatives were sort of organized and aggregated around 4 strategic pillars. The first one was promoting advanced team-based care. And a lot of this was intentionally investing in the development of our physicians and APPs as leaders, leaders not just of departments, but leaders of their care delivery team, and being able to measure their effectiveness as leaders. Secondly, a lot of initiatives around practice automation and efficiency and working with our IS department. Thirdly, promoting individual, team, and organizational resilience. And then our last strategic pillar was improving provider-to-provider communication. And I think a great compass for any organization's efforts in this arena is the American Medical Association Joy in Medicine Award. This is an award that assesses an organization's commitment to well-being, and its commitment in dimensions such as, firstly, just measuring well-being, an organization's commitment to leadership development, its commitment to practice efficiency and promoting teamwork. But it's also about ensuring that the organization's board of directors is informed about the state of well-being and of the office's efforts to promote well-being at the organization. So in 2019, I was really delighted that Ochsner Health was one of 22 health systems to receive this award. All the health systems that receive the award are outlined with stars. For those of you who are not familiar with New Orleans, you can just turn on the Weather Channel after this meeting, and you'll see where New Orleans is. And I think it was great that we were the only health system in the Gulf South to receive this accolade. So COVID hit us the second week of March, after, I guess, our presumed super spreader event, which was Mardi Gras. And 2 things became apparent. The first was that we needed to move down Maslow's hierarchy of needs. A lot of our offices' work pre-COVID were in activities focused at the top of Maslow's pyramid, so promoting a sense of belonging, promoting self-actualization work. We needed to move down to the base of Maslow's hierarchy of needs. We also needed to broaden our scope. So pre-COVID, our office was just looking at well-being as it pertained to our employed physicians and APPs, but certainly in the short term, it seemed clear that everyone, all our employees, needed our help. It seems that folks could not focus on the important task at hand if there were safety and physiological concerns. So will there be adequate PPE? Is my compensation going to be safe? Can I be sure my colleagues will not be furloughed? What about childcare for my children? And I think really the highlight of our organization's response was how decisive our executive team was and their communication. So within a weekend, childcare was provided for our employees that needed childcare. There were communications that comp would be safe, communications about our supply chain efforts, and that there would be no furloughs. This slide kind of shows our specific COVID response. So early on, we partnered with other service lines and units like our behavioral health service line, corporate wellness. I think our most effective intervention was shown on the left, where we did inpatient unit-based rounding and did team and unit debriefing. We set up physical decompression zones where people could go mid-shift or post-shift to unwind and engage in mindfulness sessions. We developed, again, with our behavioral health service line, 24/7 crisis support for those that needed. We also designed a peer support network to provide emotional support for those of our employees that tested positive. And then lastly, we developed a number of support offerings for our leaders to help their teams through this challenge. So there have been significant headwinds in 2020. First off, COVID-19. I think most of the country has been affected by this, but we were hit early and hard. I think early on we had the highest per capita hospitalization rate, highest critical care utilization and vent utilization rate. Secondly, New Orleans, like the rest of the country, has been affected by social and racial unrest. And maybe a little unique to Ochsner has been the real threat of 7 hurricanes and the psychological toll. So I was reading this two days ago. I think in the last 4 months, New Orleans has been in a cone of threat for 30 days, all told. So 1 in 4 days, people come to work and there's a threat of a hurricane in the next 5 days. And this can be, obviously quite distressing. We had conducted the mini-Z for the first time in April of 2019. I guess that would be considered peacetime. We thought April of 2020 would not be the greatest time to resurvey the group, but eventually we felt we needed to resurvey the group, and we did so in June of this year. And honestly, I had no idea what our scores would look like, whether they'd go up or down. For those of you not familiar with the mini-Z Wellbeing Index, it's a validated instrument. It specifically looks at, I think, unique drivers of burnout amongst our clinicians. You can have a multiple customizable questions, but there are 10 core questions that are scored 1 to 5, and higher scores are always better. So these are our scores, compared to ourselves in 2019 and compared to national benchmarking. Purple would be our 2019 mini-Z scores. Blue were our scores from a few months ago, and gray is national benchmarking. You can see the questions to the left, the 5 questions to the left, really get at more of whether there's a supportive work environment, and the 5 questions to the right are more delving into workflow and EHR satisfaction and stress. And you can see that year over year we'd improved in all 10 questions. And I specifically want to mention that the survey and the scores are not the strategy, and that this isn't mission accomplished. But I did think this was a nice validation that we might be directionally correct in where our strategy was going. So you may be wondering, as I was, if a small change of 0.1 or 0.3 was statistically significant. And the AMA was helpful in providing us with this data. You can see in the right column that there was that the changes were statistically significant in 9 out of the 10 questions, and approaching statistical significance in care team efficiency, and then our overall scores and subscales had improved in a significant fashion. This slide basically shows our decrease in burnout with 15 months of effort. So burnout went down from 52% in April of 2019 to 41% in June of this year, which I think is pretty remarkable with just a year or so under our belt. Now, for those of you needing to make more of a business case to invest in programs to support physician well-being, the American Medical Association actually has a helpful tool or calculator to estimate the cost of physician burnout. And I think this is a very conservative estimate that factors just really the cost of physician turnover, the cost of replacement, recruitment, ramp up. It does not include, I believe, discretionary effort, quality and safety, litigation costs. But you can go to this calculator, as I did last year, and plug in our group size, which was 1,500 last year, our voluntary turnover rate, our burnout rate, and it will spell out an estimated cost. In this case, it was $15.2 million. And then I went to the calculator again this year, plugging in the group practice size, our burnout rate, our turnover rate, and it estimated a cost of physician burnout of about $11.5 million. So you can make an argument, a very conservative argument, that these initiatives had sort of saved the organization about $3.6, $3.7 million. So you can think of this tree as a metaphor for a healthy healthcare organization. The healthy green leaves are what the public sees, things like patient experience, quality of care, financial stability, even the artifacts of how clean the hospital looks like. But the key is what's underneath what the public sees. So, and that's the organizational roots and its culture. And this, I strongly feel, is built upon the well-being of its physicians, APPs, and its employees. So, you know, going back to COVID, like back in March and April, our office received really, I think, overwhelmingly positive feedback from our frontline employees, as well as our physicians and APPs about our offerings. I put this slide up. My mom made me study Latin rather than typing in high school, which was probably a mistake in retrospect. But I loved Roman history. And I was reminded of this story, and this is the story of Julius Caesar bringing his troops back from exile in Gaul to return to Rome, essentially declaring a civil war against the Roman Senate. And crossing the Rubicon River in northern Italy was considered his point of no return moment. And I think as I reflect, COVID-19 was our office's crossing the Rubicon moment in terms of broadening the scope of our activities. So, you know, anytime you make a big change, there's some risk associated with that change. But I think fundamentally, as a compassionate healthcare organization, expanding our scope seems to make sense right now. And we're in the process of putting together a strategic plan for our executive team to review next month. I think I'm going to give you a preview of what we think a comprehensive strategy targeting our physicians, APPs, and employees could look like. So I wanted to chat a little bit about the power of vulnerability. I was in Toronto for SARS-1 in 2003, and SARS-1, don't get me wrong, was much more limited in scope than SARS-2. But there were well-studied mental health sequelae coming out of SARS-1 amongst healthcare workers. And one of the silver linings in Ontario was this real sort of glasnost or openness about destigmatizing mental health amongst our healthcare workers. And this started with leaders talking at times about their own struggles, agencies looking at questions they put on applications. And so fast forward to this year, I sent this open letter to all 30,000 employees, and it was entitled, How Are You Really? And I mentioned in the letter that July and August, you know, for the past 2 decades is always challenging for me. It represents the anniversary of the birth of my son Bennett and his death the following year. And while I struggle a bit, you know, most years, this year it was more difficult because I didn't have the sort of compensatory mechanisms. And some of those include going back to Canada for a couple of weeks, spending a lot of time with loved ones and friends, being able to visit his grave. And I sort of realized that it was harder this year. And then it dawned on me that this story isn't unique to me. I wasn't putting this letter out to get sympathy, but really everybody has their own story. And in order for people to feel comfortable coming forward to get help, I think they need to see leaders having these conversations. And I wasn't sure how this would be received by our employees because it wasn't the usual real positive tone in system-wide messages. But I was pleased to say that the open rate, the response rate, the engagement was very positive, very high. It generated the highest number of responses, I think, of any of our executive communications. And you can read a few of the comments. And I think while it can be uncomfortable at times to have these conversations, I really believe that authentic, vulnerable leadership and communication is essential now more than ever. So again, this is a sneak peek of our broader strategic plan that includes both our physicians and APPs as well as our employees. You can see 3 areas of focus include the group practice leadership development, a second focus, practice efficiency, and then our EPIC or EHR clinician user experience. And I think these areas of focus principally touch on our physicians and APPs, and I think it highlights the emphasis on practice efficiency and leadership quality, which are the number 1 and number 2 drivers of provider professional experience. But now you can see we are including things like improving care team communication amongst the whole team, more of a focus, a more intentional focus on resiliency, organizational and personal resiliency. Pre-COVID, I thought that was a bit of I didn't want to lead with that, but it's been clear since COVID that people are really yearning for more help in this area. And then finally, developing and promoting a culture of wellness at Ochsner. And I think these will affect and touch all our employees, not just our clinicians. So let me close with this visual and this slide that I presented to our physicians and APPs when I assumed the role of Chief Wellness Officer just under 2 years ago. I think we have accomplished, we have so much to accomplish, and we've accomplished so much as professionals, as healthcare systems, and as a society. But our people are our most precious resource, and they will drive really our success. And well-being is the key to their success. So thanks for listening. Thanks for your attention. And at this point, I'm going to hand things over to Dr. Krasinski. Thank you.
Thanks, Nigel. Wonderful presentation and really moving experience that you've shared with us. So what I'd like to do is to share with the group some of the resources that are available through the AMA. We'll talk about the Coping with COVID survey. We'll talk about some of the Steps Forward toolkits. And I'll give you a preview glimpse into our Action Labs learning curriculum. And then we'll have time for conversation after that. So as Dr. Gerger was describing, we have developed a mini-Z burnout assessment tool, and it's something that we do at no cost. It's part of our mission work. And we'd been developing that. We're really ready to ramp that up when COVID hit. And so we very quickly pivoted. We worked with our academic partner, a set of researchers out of Hennepin County Medical Center in Minneapolis, and over a weekend created the Coping with COVID survey, which we've iterated a couple of times since that time. And that is where we've put our efforts at surveying for the time being. This too is available at no cost. We've had over 70 health systems that we have surveyed with this tool and have had 40,000 plus respondents. These are respondents that are both clinical, so nurses and physicians and other therapists, and as well as non-clinical staff, housekeeping and kitchen staff. And we've had now 28 states represented within that survey. Some of our sites are surveying multiple times. And I wanted to share with you some of the findings that we have had from this, from our initial few months. And we've recently looked, so this was our first 10,000, now we've looked at our first 30,000, and the results are pretty similar. That fear of exposure is high. It's over half of all the respondents are afraid of exposing themselves or their family to COVID. More than 30% attribute higher levels of anxiety and depression to COVID. And we've noticed that our stress score, which is a score from 4 of our questions combined, the stress score is highest among nursing assistants, housekeeping, and nurses, and also among individuals of color. We also found that there are some protective factors, that those who feel more valued by their organization and those who endorse having a strong sense of purpose in their work have lower stress scores than those who don't. The other thing we've looked at is we've looked at we have a free text question. So we've done a qualitative analysis of our results. And we find the top themes in this for the comments are first and foremost, financial and job security. Second, the lack of PPE. Third, communication. Is there transparent communication? Am I kept up to date about what we know and what we don't know at this time? It's more important that that be transparent and even that leaders say, this is the best we know now, and this is what we're doing to learn more, as opposed to trying to somehow sanitize what's known. And then there were some positives. The fourth category, fourth most common kind of free text entry was a recognition of a reignited passion for healthcare. And then the fifth was just the importance of peer-to-peer support. So here is one nurse who had written in her free text, as hard as this time has been, I feel like it's what I signed up for when I became a nurse. I have felt a really important sense of belonging. I feel like I'm making a difference. And any of our workforce who can endorse that kind of sentiment, we know is protected against higher stress than others. There's another finding that we have from our study that I think is really important for our future, and that has to do with workforce. We know from earlier epidemics that there will be, in the next 6 to 12 months, a decline in the workforce. And so 20% of our respondents indicated that it was moderate to highly likely that they would reduce their effort to part-time in the next year. And particularly worrisome is that over 30% indicated that they plan to leave their position and leave their profession in the next 2 years, that was a moderate to high probability. So I think we need to be looking ahead to how can we protect the workforce so that we have less of that reaction. And I'll just pause here to mention the idea of creating a resilient organization, which Nigel mentioned. And I think that's where we need to be focusing on. What are the things organizations can do to create a more resilient institution, a place that protects and supports the individuals within it? Some of that may be addressing individual resiliency, but much of it is addressing financial and job security, keeping us safe, keeping us informed, making sure that efficiency of practice is a priority, making sure connectedness among the workforce is a priority. So I'd like to mention some of the resources that we do have available at the AMA. These are also free and widely available. You don't need a username or a password. You can just go to stepsforward.org. And we have over 60 toolkits. These are meant to be practical, actionable, one-stop resources for all you would need to do to get started on whatever the topic is. So under Culture of Wellness, organizational culture, I've picked out a few to highlight. One is creating a resilient organization, caring for the healthcare workforce during crisis. And Dr. John Ripp, who is the CWO at Mount Sinai in New York, and Dr. Tate Schoenefeld, the CWO at Stanford, Dr. Marie Brown and I wrote this to give a roadmap for organizations. We also have one, creating the organizational foundation for joy in medicine, and that's where you'll find the calculator that Dr. Gerga presented, that we created out of existing literature. That's where we got the data that drives the equations, the algorithms for that calculator. And then one of my favorites is getting rid of stupid stuff, patterned after and written by the author of a New England Journal article of the same name. And it's about getting rid of the sludge that is keeping our clinicians from their patients. And so those are a few to highlight for you there. We also have a good number on team-based care and workflow. So we get down into the granular details about how do you do daily team huddles? How do you hold a team meeting? We include agendas, sample agendas, for example, to get you started. How to do pre-visit planning and pre-visit lab. How to do what is one of the most powerful interventions to reduce burnout, and that is advanced team-based care with in-room support, that is team documentation, so that the physician can give their undivided attention to the patient while an assistant is doing important work of data management. And then for each module, we have success stories. So case studies. These are 10 or so case studies for caring for the healthcare workforce during crisis, telling the story of individual organizations and what they have done to keep their employees safe and prepared and informed through this crisis. So I'd like to close before we open it up for further discussion with a frame that I'd love to present to you, and that is that while burnout manifests in individuals, it primarily originates within systems. And so as system leaders, there's an opportunity to care for the individuals who care for patients, to care for the workforce, and to look at the culture of wellness, to look at efficiency of practice, and to ensure that we are moving toward a more and more resilient organization. And then finally, I'd like to bring it back to where Dr. Gergra ended, because I do believe that's such a critical piece, that the way we'll get to the quadruple aim, the way we'll get to the triple aim of better experiences for individuals, better health for the population at lower cost, is by considering that fourth aim of the quadruple aim, and that is the well-being of the workforce. So I'll reiterate that motto: our people are the key to our success, well-being is the key to theirs. And with that, thank you so much, and I think we'll soon be having a moderated Q&A.
Great, thanks, Dr. Sinskey. If you're interested in learning more about how your organization can take advantage of any of the resources that Dr. Sinskey highlighted, especially the COVID survey, please visit the website you see shown right now, clinician.health. Make sure when you go to that website that you put in that you heard about the survey through Becker's. Actually type in Becker's. I ask you to do that because as Dr. Sinskey mentioned, there are a lot of organizations that are looking for access to this tool. And by putting in Becker's, we'll make sure that we do everything we can to prioritize access for your group. I'll turn it back over for questions. But if you want to reach out to either myself or any of our speakers individually, please feel free to do so using the contact information on this slide. I do want to take a moment to, again, thank Dr. Gergra for sharing all of his insights on the journey that Ochsner Health has taken. Every time I hear it, it truly is inspiring. And with that, let's see if we can help with any questions. Molly?
Yes, thanks, Jim. And thanks, Dr. Gerger and Dr. Sinskey, for that fantastic presentation. A lot to be proud of there. So attendees, we will now begin today's question and answer session. Like Jim said, please submit any questions you have by typing them into the Q&A box you see there on your dashboard, and we'll try and get to as many questions as we can today. So some questions have come in the meantime, and Dr. Sinskey and Dr. Guger, I'm going to pose this first one to both of you. Dr. Sinskey, you had mentioned the more than 60 plus accessible toolkits that are available on the site you shared. But this attendee would like to know what advice, perhaps anecdotally or firsthand advice, you would give to a team that is starting a well-being program. Dr. Guger, can I point this one to you first, and then we'll check in with Dr. Sinskey?
Yeah, I mean, I have a couple of thoughts. One is to think long rather than think short. So it's really, I mean, when I started with the Wellbeing Task Force, physicians are reasonably impatient, and physicians wanted this solved in a month or two. And so you really have to manage expectations. You need to think long term and not sort of one and done initiatives. You need to really have a champion within the C-suite, and obviously Dr. Hart and Warner have been fabulous. But then you have to get buy-in. You have to influence others in the C-suite. You need to, make sure that your chief financial officer understands that this is important and that there's really executive alignment. I can't overstate the importance of listening and spending the better part of the first year listening to what's going on and just openly discussing that there are no certain answers, but people want to be heard, and more importantly, they want to. When I would conduct these focus groups, not only would I bring somebody to take notes with me, but within a week I would send back to the team what I thought I heard from them. So I think those are just some random thoughts, and I'll just add also making sure you have a robust communication rhythm and plan. I would just add that. Chris?
Terrific. So think long-term, manage expectations. I was just going to recap a few things, Dr. Sinskey, that Dr. Guger had said, but go ahead.
Yes, those were all good things. And perhaps I'll add to that a couple of other resources. One is we do have 2 Steps Forward modules on Chief Wellness Officer. One is for the organization in establishing that position, and the other is for now you've been appointed as a Chief Wellness Officer. What do you do? What do you do in that first year? And so those are co-written, myself and Dr. Kate Schoenefeld, who was the first Chief Wellness Officer in the country. And so there's just a lot of practical advice there. I have also had many individuals come to me and say that they use the Joy in Medicine recognition program that Nigel referred to as a roadmap. And what they did was they would take that to their senior leadership and say, here's what's been identified as levels of achievement in domains of commitment, assessment, leadership, efficiency of practice, teamwork, and support. And here's where we are, and these are some of the things we could do. So I think that that's served as a guide for many and as a communication tool in getting the buy-in that Dr. Guger was able to achieve in his organization. And then finally, I think for many, it's making the business case. I know for Stanford, it was when they were able to identify that they were spending something on the order of, I believe it was $15 to $30 million a year on burnout. They were just spending it at the far end, that replacing physicians who had left. And they recognized that they invested a small fraction of that at the front end to reduce the likelihood of burnout and leaving, that would be a positive business proposition. And I'll stop there.
Okay, thanks, Dr. Sinskey and Dr. Guger, for your valuable insights for the attendee's question. This next question, I think, is in line with Dr. Guger, some of your remarks, but how do you get people motivated to participate? Any tips or best practices you would feel comfortable recommending to this attendee?
Yeah.
Dr. Gabriel, I'll pose this one to you first.
Actually, I'll answer this. And this, I guess, physicians and APPs are busy, and you have to acknowledge that. But one of the most rewarding things that I've seen in the last 2 years is how many people want to get involved. I mean, there is a grassroots, passion, about this subject, and so I guess I just haven't, touch wood, had a lot of difficulty engaging with different facilities, different departments. I'll just sort of say that. I think, sometimes engaging with their chairs to make sure that, their chair is aware that, a patient-facing physician is involved in one of your work groups, just so that it's recognized and that there's the ability for the, the physician or APP to be involved. Those are just a few thoughts.
Thank you very much. Dr. Sinski, I'm going to pose this next question to you, and if you would like to redirect it, go right ahead. But this attendee would like to know which of the validated surveys might be best to assess the outcome of a physician wellness program geared toward non-clinical physicians, so physicians working in medical affairs or managed care, for example. Would you have any recommendations?
Sure. Well, what I'll do is I'll answer that in two parts, if you don't mind, because I'm often asked what's the best burnout assessment tool to use for physicians and APPs, because there are 4 or 5 commonly used tools: the Mayo Wellbeing Index, the Stanford Professional Fulfillment Index, the NASDAQ Burnout, and the Mini-Z. And while we went with the Mini-Z because it does give some predictors of burnout that are actionable, chaotic work environment, EHR, stress, it's more important to measure with something. And so we support the idea of measuring with all. We've recently done a study where we've compared the results across those 4 instruments, and it turns out they're pretty darn similar. The Mini-Z that we've created, we have a Mini-Z for physicians and APPs, but we also have a Mini-Z that's been developed for nurses, and then a Mini-Z for administrative leaders. So we have, and we have one for medical students in the pipeline. So there are versions of the Mini-Z that are available for non-physician, non-APPs.
Okay, terrific. Thank you, Dr. Sinski. Dr. Gigra, another question for you. And I think this goes in your remarks. Some of your advice was to think long-term when starting out on this effort, think big picture, understand that it takes time. This question is, how do you deal with the cynics when well-being work really does take years to mature? Do you have any practical advice you could share on that?
Yeah, well, we don't have any cynics at Ochsner Health, so that hasn't been, I'm just joking. Actually, Dr. Sinski will probably remember when we did the Q&A.
I do.
So yeah, they're out there. I would say it's been a little easier for me as I've removed myself from traditional operational roles, so I can sort of see this a little more scientifically. But I think not running away from them. I'll tell you, if you can solve one of their problems, you've got a friend for life. So we have on our SharePoint site, we have a sort of an escalation button that a physician or APP can go to if something's not getting done. And I can tell you, if you're able to connect them to the right people and get that problem solved, they're really happy about that. But I think this gets back to communication, that it's managing expectations, that it's the long game, not the short game. That being said, some short-term wins are embraced and are helpful. Those are just a few thoughts.
So Nigel, I would actually like to add on to what you've said.
Please.
I would encourage others to consider leaning into your dissenters. That dissenters have something to teach us, something perhaps that's in our blind spot. And if we can focus on trust as one of the subterranean domains of our work, that anything we do that increases trust will be beneficial. If we can help with, as Nigel said, with one of the dissenters' issues, they will be some of your strongest supporters and really help spread, because when a message comes from an unexpected source, it is particularly powerful. So when a dissenter at one program that I visited, who wasn't interested at all in advanced team-based care with in-room support, he pulled me off to the side and said, "This is a dumb idea. I don't know what Dr. whomever is thinking. It's just a dumb idea." And 2 years later, I came back to that organization and said, "This is the best thing that's ever happened, this advanced team-based care with in-room support." And he became a champion whose voice was more powerful because he was a convert, if you will.
Perfect. So in terms of dealing with those cynics, don't run away from them, but actually really lean into them and understand that those cynics can become your biggest champions and help you see your blind spots, like you said, Dr. Sinski. So this next question, Dr. Giger, I'll pose to you first, and then Dr. Sinski, if you want to add on with any other observations or what you're seeing elsewhere, I welcome you to do so. But the question is, how is program effectiveness being tracked and monitored? In other words, how is data and analytics being leveraged to enhance the well-being of the physicians?
Yeah. Well, if I'm understanding the question correctly, I think, and very early on, you want to define, primary measures of success, things like physician engagement, burnout, the mini-Z. But those are usually going to take a while to move the needle on. So I also think it's very important to determine secondary metrics of success, things that you can track right away, like pajama time, team-based documentation. Dr. Sinski has a great article on this. So what are the secondary measures of success that will eventually lead to the primary measures of success? And then I think it's important to establish process metrics. So things like, how often are you communicating? How many clinicians are you getting in through EHR optimization annually? Things like those would be process metrics, and really having a dashboard and being able to track those things.
So, and Nigel, you mentioned several of the things that I had made note of for the question. And I think one of the ways you do engender trust and buy-in in the workforce is to regularly measure things that matter. So burnout, yes, and engagement, yes, but also the EHR use data. And so we do have 7 core metrics that we have proposed and published that look at the back-end metadata of the EHR, that pull back the curtain for organizational leaders to see what's actually happening in their frontline clinicians. And what we're finding is, in general, particularly in primary care, there is 2 hours of pajama time, work done on the EHR at home at night after the kids go to bed. And so if that data point, which can be extracted from Epic in the back end through Signal, and also a version of that from Cerner through Lights On, if that metric is something that the leadership has on their data dashboard and potentially is even reported annually to the board, that's a data point that will be managed. And I also think measuring leadership by asking those who are led to give feedback on their immediate supervisor has been a powerful way that organizations have led to change.
Terrific. Well, thank you so much for answering attendees' questions today. that is all the time we have for our webinar. So I want to again thank our presenters for really this excellent presentation and so many valuable insights, and of course thank the American Medical Association for sponsoring today's webinar. On behalf of Becker's, we hope you enjoy the rest of your day, and we look forward to having you join us for future webinars. Thank you.